Lovely. Thank you very much. Good afternoon, everybody, and welcome to this webinar on mental health advanced practice. My name is Navina Evans, and I'm Chief Executive at Health Education England, and I'm really thrilled to be able to just say a few words here before you all get stuck in. Just to let you know a little bit about me, this is particularly special for me because my background, I am a child and adolescent psychiatrist, so I still consider myself to be part of your family, even though I haven't actually been in practice now for probably about 4 years, but up until 4 years ago I was still in practice. And it's really important to me personally, but I also think that this is a real opportunity for us in mental health to lead the way. So I have 3 things to say. First off, thank you all for the amazing work that you've done over a long period of time, but especially over the last 18 months or so, where the pandemic has really raised all sorts of issues for all of us, both in our personal lives, our social lives, but also in our working lives. The pandemic has also lifted a lid on things that are very uncomfortable for us as a society, but also as a community of health and care workers to face up to, which is really about social justice, about inequalities, and about the fact that population health is something that is everybody's business. Now, having said that, mental health is a crucial part of population health, and we have also seen a lot of the impact of the last 18 months or so on mental health. We are also hearing a lot about the pressures on mental health services right now, and that people predict that there's going to be even more pressure going forward. So this is a really timely time for us all to stop. And whilst we're all rushing around trying to cope with reset, recovery, backlogs, acute pressure, it's also really important to stop, take time, and really think about how we practice, and that we build on all the great good things that we've practiced in the past, and we think about how we can really modernize and practice for the future. You all and we in the mental health community are really good at doing this. If you think about the history of all of our professions, we've changed so much over the last 100 years or so, and we're continuously changing. The other thing that we're really good at doing is actually listening properly and carefully to some of the difficult things that our service users and their carers and their families tell us, and we adapt the way we work to suit them. The final thing is that we are also a sector of care, health and care, that truly thinks properly about quality of life, about the power in communities, about the power that we all have collectively to make things better. And we are also a sector that are constantly thinking about new skills, new ways of delivering care, of being sensitive to what people need, and therefore always thinking new roles. So this mental health advanced practice is another area of, I think, really future focused way of working and thinking. So I'm really proud that you are all doing this work here. Start to innovate, start to agitate, start to make people think differently, and collect the data, collect the evidence, collect the stories that bring the data to life, and then we will spread it and have a movement across the country for mental health, and then we will spread it beyond mental health in this country to other parts of the country and the world. I'm getting a bit carried away here, but I think it's possible. And then also we start taking the principles of advanced practice further and further into other parts of health and care, not just confined to mental health. So that's the ambition. You've got a few hours to sort it all out. I look forward to hearing of your success. So good luck, and thank you so much for all your hard work. Enjoy.
Thank you, Navina. Hello, welcome everyone to our East England First Mental Health Advanced Practice webinar. We have a full programme today. So firstly, my name is Katie Cooper. I'm the Regional Faculty Lead for Advancing Practice with Health Education England. I'm just going to give you a quick overview of the work that we're doing within HE and the developments within advanced practice. Then I'm going to hand you over to Dr. Ziv, who's going to look at AP roles in practice within mental health and the potential for these roles to be developed. Then we have Stephanie Tempest with us today as well, who's going to look through the credentials and the assessments that have been developed nationally. And then we have Stuart Maddox, who is going to discuss his development as an AP and now to a consultant practitioner within mental health. And then we've hopefully given plenty of time to have some questions and answers at the end of this to really see what are your concerns, how we can help and how we can move this work forward within the East of England. So I am going to share my presentation. I will admit that my internet connection has been a little bit funny this morning because of the weather, so I am going to turn my camera off, so apologies for that. But I'll just share my presentation. Okay, can everyone see that?
Yep.
Yeah.
Can be seen.
Okay. Okay, so just to give you some background, advanced practice roles are not new within the NHS, and within the NHS long-term plan and interim people plan, it clearly acknowledges how advanced practice roles can significantly help in meeting the short and long-term workforce demands, but also will have the ability to drive workforce transformation agenda forward. However, there are challenges with this, and historically we know that the majority of advanced practice roles have been developed as a reactive service response, and this has resulted in disparities as stated in the educational standards, the competences and capabilities that practitioners have in job descriptions, job planning and pay bands, and this won't be new to anyone working within advanced practice. However, this did raise concerns regarding the professional and organisational liability of practitioners working at advanced practice level. And to overcome these and to ensure robust governance and the future development of advanced practice roles, the Centre of Advanced Practice and the 7 regional faculties have been established. So the Centre of Advanced Practice has been developed to oversee the workforce transformation of advanced level practice, and they've done this by establishing and monitoring standards of education and training. They're in the process of accrediting advanced level programmes. They're supporting and recognising practitioners and growing and embedding the advanced and consultant practice workforce. They're also developing professional credentials, and going forward they will maintain a national public directory of advanced practitioners, which I'll talk about in more detail later. For the regional faculty, our main aim is to ensure that advanced practitioners are embedded as part of that workforce planning and a solution to support service redesign and change. So from our point of view, these are our key objectives over the next 12 months. Firstly, to ensure we have a consistent understanding of what advanced practice is and based under the 4 pillars of advanced practice. Ensure that advanced practice is part of the workforce planning going forward. And we're also looking at the commissioning frameworks and developing ACP strategies, ensuring there's robust governance across all of the 6 ICSs within our region. We're also doing an enormous amount of work regarding supervision, making sure that we're now in line with the new national standards and looking at how we develop a governance and guidance document on supervision for the East of England. And we're also developing a directory of advanced practitioners, and we want to look at developing communities of practice in all of the different professions, but also our ACP leads. And it's about sharing best practice. We have some pockets of brilliant work being done. It's not starting from scratch, it's about sharing and developing that going forward. So this may seem like we're going back to basics, but what is advanced practice? So in 2017, the NHS England commissioned work specifically looking at defining advanced practice. Prior to this, there was a plethora of different definitions, and it didn't enable us to have a standardised approach of how we develop these roles going forward. So with the new definition, it looked at the core capabilities that anyone with advanced in their title should be able to map against. So this was important as it clearly set out to organisations and practitioners the minimum capabilities and level of practice that they needed to be working at as an advanced practitioner. And this is going to enable us to develop a workforce that is not only sustainable, but also has transferable skills regardless of the professional background. The national definition clearly defined that advanced practice should be delivered by experienced healthcare practitioners. It was a level of practice and not a job description. It was underpinned by master's level or equivalent training, which is characterised by a breadth of capabilities and competencies, not depth of expertise or specialism. Key principles include safe, effective, autonomous decision making in complex and uncertain situations within practitioners' own scope of practice. And going forward, all developments of advanced practice frameworks and capabilities will be centred on the 4 pillars of advanced practice. I'm sure you're all aware the 4 pillars are expert clinical practice, leadership and management, education, training and development, research and evaluation. Now, currently, the majority of posts that have been created have focused on the expert clinical practice pillar. However, for these roles to be recognised by the Centre of Advancing Practice and for practitioners to be added to that national register, they will need to demonstrate that they are working across all 4 pillars in line with the new national minimum standards, which was stated in the multi-professional framework. HEI programmes will need to demonstrate a blended integration across the 4 pillars to get accredited by the HEIs. And this is something that we're working a lot across the ICS to
There we go. Okay, I don't know if you still hear us, but you've frozen.
I can hear you. Can you hear me?
Just a little bit robotic. You might just need to, if you stop your camera, it might help. If not, I'll try and take over.
Hold on. Does that stop my camera?
Stopped your camera and I can hear you.
You can hear me. Okay, we'll carry on. Apologies, everyone. So the next slide that I just wanted to briefly touch on, but obviously Stephanie will go into more detail, is to let you know that obviously the mental health, learning disability and autism credentials have been published. The aim of the credentials is to provide standardised and structured units of learning, and they should increase advanced practitioners' capability and support the development of existing and future advanced practice roles within mental health. So the links are there and they can be found on the Centre of Advancing Practice website if you don't have access to these. What I would say, and what's really important going forward, is that departments and organisations need to identify and agree the advanced clinical practitioners' competencies and capabilities, ideally prior to someone starting training. However, I appreciate for those that are currently in these roles, it may need to have a retrospective review of these capabilities and match against what their roles currently are. And this is to ensure that we have a clear understanding across the MDT of the skills and scope of practice under which advanced practitioners and trainees will be working. And these are specifically for the mental health workforce. So one thing that I touched on earlier on was the Directory of Advanced Practitioners, and this is being developed by the Centre. So just to clarify, all advanced practitioners will remain under the regulation of their professional bodies. That is unlikely to change. But what the Centre of Advanced Practice have done is developed a public directory, and this will be for individuals who have either completed a HI accredited programme or are able to evidence their education and clinical training maps against the more professional advanced practice framework via the portfolio route that I'll go through in a moment. The reason this is important, it's about the governance. It's ensuring that everyone that has this title has that underpinning knowledge and understanding and has had the training required to enable them to work within this scope of practice. From an East of England point of view, we will be expecting that all practitioners with advancing their title will be working towards or will be on the register once it opens. And there are 3 routes to accreditation for practitioners. So as previously stated, the first one is through the HI programme accreditation. This has been launched and it's underway. It is going to take a couple of years to get all of the HI programmes accredited. There are just shy of 300 programmes nationally. So all of our HIs within the region are engaging with this process. We are working closely with them to make sure that they are mapping against the more professional framework of advanced practice. And what we are currently saying is anyone who has undertaken an MSc advanced practice programme since 2017 This will be the easiest way of you getting onto the register, because in theory you will be within that validation period when the HCI is accredited, and you will then be automatically added to that national register. Now, for anyone who is an experienced practitioner and may have undertaken their MSc in advanced practice prior to 2017, may have an MSc not in advanced practice but in a clinical modality, or have undertaken some MSc modules but not a full master's. The other route is then via the portfolio route. This is currently under development, so we are looking at trying to have the supported portfolio route live by the end of this year. This will enable practitioners to submit a portfolio evidence mapping against the 4 pillars of advanced practice with different levels of evidence, and we are producing some supporting guidance documents that will go when the portal goes live for practitioners to go through this route. There is also an independent portfolio route. We are awaiting a go live date on this. At the moment, the centre is certainly looking at the supported portfolio route because we know that during the feasibility studies, people were more likely to become accredited and get that recognition with a little bit of support. And that's where that additional funding and finances come through to help practitioners who are currently in role. As soon as more information comes out, we will let you know. What I will say is, if you haven't already signed up to our regional mail base, the link is on the end of this presentation. That will probably be the quickest way of you knowing that the portal is open. And for the first run of the supported portfolio route, it will be a first come first served basis, and we have about 300 places allocated within the East of England to undertake this within this financial year. So just make sure that you're registered and that you're aware, and there's no reason why you couldn't start mapping against the more professional frameworks. There's 38 capabilities that you'd need to be able to evidence against, so that work could start to be undertaken at this point. And then the last route, this is probably the one that is the furthest to being completed, but the discussions are being had. So we're fully aware that there are some professional bodies that offer an accreditation or a credentialing process for advanced practice. What we are doing, and we have agreement with all of these bodies, is that we don't want to increase the work on practitioners. So we want to get to the point that if you're accredited by your professional body for advanced practice, you would also be registered on the advanced practice registry. But we have to do quite a bit of mapping work against what their criteria and what the HE criteria is before we can enable that. So although it's in the process, I do think that's a little bit further down the line, but the discussions are being had at this point. To support the organisations and the practitioners, Health Education in England within East England have different funding routes to help support. So if you are a current advanced practitioner or we're looking at a trainee post, we do provide full MSc funding, which would be a £6,000 training grant per year per practitioner. 2,600 of that needs to be ring-fenced for high quality supervision. We also provide top-up funding, and this may be more relevant for current APs or trainees who have undertaken other MSc modules that can be APL'd across. So we will fund to a maximum of 100 credits. However, it must lead to a full MSc ACP award on completion. The portfolio routes, like I said, we have 300 allocated at the moment for the East of England within this financial year. This is to help practitioners be able to complete that portfolio and submit to get on the register. The funding will actually go to the HI or professional body. It won't go to the organisation or the individual, but it will be enabled to support them through that submission process. And then just so you're aware, this year we did get additional national mental health funding, which enabled us to offer more than what we would have from our normal demand and scoping within Health Education England. We haven't been given any confirmation if this will be repeated next year. I think they're hopeful, but we'll come out to you and do demand scoping specifically within mental health to see if we can increase our numbers for the 22-23. And then just to summarise and to give you an update, what other work we are currently undertaking. We are in the process and have almost completed an ACP guidance document. This is looking at commissioning timeframes, it's the funding, it's generic job descriptions, it's just to give organisations a general understanding of what advanced practice can look like within organisations. We are in the process of developing some mental health case studies to highlight current and future AP roles. As I said, we have completed a generic ACP job description. Going forward, what I would like to do is also get some specific mental health job descriptions, again, to help that business case and to help organisations understand the breadth of where these roles could really sit within the mental health pathway. We will be looking at developing communities of practice, and we are currently working with our HIs to look at the mental health programme provisions within the East of England and how this can be developed and what's required from organisations to enable our AP trainees to come out with the qualifications that they need. So just to finish, if you have any questions regarding the HE funding or the support that you can get, we do have a generic email, but we also do have our mailing list, and I would suggest any practitioners looking at portfolio route to sign up, because then that's going to be the quickest way of us letting you know when everything goes live, which is hopefully within the next couple of months. We are also looking at holding a couple of open afternoons and mornings where you can just have drop-in sessions and we can just have a quick 15-minute catch up if you have any questions. So I'll ask Kashka to put that in either the follow-up from the meetings when the presentations get sent out or in the chat box. But that's it from me. I'll just stop presenting. I'll try and put my camera back on and not lose any connection. But like I said, any questions, any queries that anyone has, we're here to support the development of this work. So please contact us and we can kind of move that forward. But in the meantime, I will hand you over to Shimrit, who's going to just discuss the opportunities for these roles within mental health.
Jim, do you want me to share your slides or?
Yes, please. So hi, everyone. Maybe I'll just wait for my slides. So can you all see the slides? Because I don't think I see it. Oh, good. Okay. Excellent. So hi, everyone. I'm Dr. Shimrit Ziv. I'm also a consultant child and adolescent psychiatrist. And thank you very much, Katie, for the excellent presentation. And thank you, Navina, for your inspiring words and introduction. So I'm the training director of advanced clinical practice in mental health. And I would like to speak today about the roles of advanced clinical practitioners in mental health. So yeah, in mental health, ACPs, not yet. I don't know why it jumped to the next. Yes, exactly. In mental,
sorry, it's doing it by itself.
Oh, in mental health, ACPs are clinicians with the highest levels of skills and compassion. And by training ACPs, we enable clinicians to achieve their full potential. This way, individuals and families can receive the optimum level of care. This next slide, please. Now, next slide. Yeah, excellent. So by training ACPs, we gain benefits both for staff, patients, and services. Trained ACPs have high motivation. They provide robust diagnosis and and evidence-based treatment. Now the next one, yeah. So ACPs are the clinical leaders of the team. Parallel to consultant psychiatrists or independently, they hold caseloads, they conduct full assessments, make decisions, write formulations, and liaise with other professionals. ACPs supervise and educate the clinical team and make the service run much more efficiently. There are many fascinating opportunities for, the next one, please. Yes, thank you. So there are many fascinating opportunities for advanced practitioners in psychiatry. It could be working with adults, it could be working with young people, it could be working with old people, it could be working in forensic services, in perinatal services. Next slide, please. AP could be the clinical lead of an inpatient unit with full clinical responsibility for staff and patient. There are plenty of opportunities in community, in crisis team. There are plenty of opportunity in home treatment team, in liaison services. You could lead an eating disorder team. You could lead a neurodevelopmental team. You can manage a personality disorder team, delivering individual sessions and group. You could lead an early intervention for psychosis team. So there are a lot of opportunity. You can have clinical role, leadership role, research role all together. It's very, very exciting. Next, please. And like Katie said, I would also like to invite you to get together and discuss these roles more in an intimate form. So on Mondays fortnightly, I will run informal drop-in sessions for ACPs and trainees. This is currently virtual. You're invited to talk about any topic you would like and to bring questions, to bring anything you would like to discuss for supervision. And once a month, we will also run a lunchtime CPD session. The first one will start next month on the 25th of October, in which I will talk about ASD diagnosis and treatment. Everyone is invited to present in the next CPD sessions, and if you would like to speak about any topic, please feel free to email me. So you can see my email here. And yeah, next slide, please. So yeah, again, to speak about the four clinical pillars of ACP, and you have to remember you're highly qualified, you're clinical leaders, and you're going to make a change. That's it from me.
Thank you, Shimrit. And I think I would just advise anyone, these are great opportunities to really start discussing and how advanced practice roles can really be embedded within the mental health workforce. And I think having conversations across the ICS, there's huge potential, but there is a lack of necessarily understanding of how we really move forward with this within the East of England. So I think starting these conversations is going to be key to be able to really embrace these roles. I'll now hand you over to Stephanie.
Thank you. I think I've got my slides with me. First of all, thank you very much for inviting me today, and hello everyone. I've just got a sea of dark screens with little icons, so I can't see lots of people, but it is lovely to be here and I hope you can hear me well. And I'm following on from three very inspirational people who are really throwing out a challenge, I think, to talk about where we go next. These, as we're hearing, these roles are evolving, they're not set in stone. So we'll have to carry on these conversations. For my role, so I'm Stephanie Tempest. I'm an occupational therapist by profession, an allied health professional, and an educator by background. And my role is to support the implementation nationally of the Advanced Practice Mental Health Framework. So I've come here today to talk a little bit about that. And next slide, please. And in terms of what I'm going to cover, Katie said, could you warn people in advance that there's a question coming towards the end, so you can have a bit of a think as I go through, and also leading on from what all the three previous speakers have said. The question for discussion really is, where do we see these advanced practice mental health roles? We've had a lovely long list of possibilities and from Shimrit already, But as I'm talking and as you're thinking, if you can just put in the chat where you see these roles within general settings, specialist settings, and also emerging settings. And so we can start to capture some of that broader thinking and to discover the art of the possible. So in terms of what I'm going to go through in my session, I'm going to introduce the curriculum and the capabilities framework to you, share a bit of work on the implementation. It's another piece of evolving work. I think you're getting to see and feel the theme of the webinar today. So we'll share with you the work done so far and also our future plans. And then if we have time, we can have more of a discussion about where we see these multiple roles in the future. So if I can have my next slide, please. It just shows and reiterates where the work sits. So Katie told you about the Centre for Advancing Practice. Part of the work of the centre is to support the development of the credentials. So we have our multi-professional framework from 2017, which Katie referenced, and the Advanced Practice Mental Health Curriculum and Capabilities Framework. Not the quickest title to slip off your tongue, but what this does, it's a contextual version. It contextualizes the multi-professional framework. So it doesn't duplicate. It takes a lot of the detail from the framework and it expands on what that looks like within the mental health setting. So when Katie talked about the supported portfolio route in the future, yes, you'll be mapping yourself to the multi-professional framework, the generic broader framework. But if you work in mental health and are seeking recognition, you'd be expected to draw on both to show how you could have contextualized your advanced practice level of knowledge and skills to our particular setting. So if we move on to the next slide, I'll talk you a little bit through the curriculum aims. So I think there's a picture of this document on each one, so you'll definitely know what it looks like when you go to download it if you haven't already. The curriculum aims to support the development of advanced practice mental health practitioners. So as we've talked about, it's about high quality, effective care, advancing the theoretical knowledge and clinical skills. This is master's level clinical skills and theoretical knowledge. So we have highly skilled practitioners working with a high level of complexity and acting autonomously. But it is about all those four pillars. So you'll also see reference to advanced leadership and management, evidence-based, values-based knowledge, and that all of that leadership work to support the organisational learning. So that's what the curriculum, the broadest aims of the curriculum are. And if we move on to the next slide, we'll look at a little bit more detail. So in terms of the delivery is it's a developmental pathway, and it comprises a real mixture of delivery modes. So there's workplace-based learning, as you would expect. There's formal teaching and learning opportunities through the HEI. There's self-directed learning requirements, workplace supervision, and then also the centre has all the governance and appraisal and feedback systems as well. So the curriculum is delivered through a whole mode and range of settings. If we move on to the next slide, I'm not going to talk you through each of the capabilities. That would be very long, and you can look at them yourself. But to capture what they are, there are 6 domains. You'll see here, and we're very proud and rightly so, positioned Person-Centred Therapeutic Alliance as the first domain to really reiterate the importance of that piece. And then as we go through the domains, there's capabilities for assessment and investigations, formulation, collaborative planning, intervention evaluation, leadership management and education. I'm just going to take a snapshot of one. On the next slide, you'll see an example. So if you're a trainee, if you're already an advanced practitioner and you're on the call today, we would be looking at you providing evidence that these are the you're working at this level. And that you can demonstrate a variety of capabilities. So domain B, assessment and investigations, you'll see it is about the mental health knowledge, it's about the physical health knowledge, but it's also understanding that complex interplay. As Naveen was saying at the start, we need to look at mental health through a social justice lens. It's so much broader than understanding the body. And our advanced practitioners are key in developing a deeper level of knowledge across the system for the psychological, biological and the social theories of mental health, and that interplay between all of the social factors and the legal obligations that they situate themselves in. So you would be expected to look at the capabilities across the domains and all the curricula that are being developed by the HEIs will be expected to deliver against these capabilities. So that's a whistle-stop tour of the actual framework itself. I want to share with you now a little bit about the work in progress, what we're doing to develop the infrastructure. Again, it's another sharing with you the work in progress. So if we move on to the next slide, you'll see that we've taken the decision at a national level to have a sort of tripartite infrastructure. So our advanced practice in mental health, we have a national steering group, and that steering group has educational people from education, from practice, lay representatives, and a mix, and that's the decision-making body. Alongside that, we have an education forum and a national community of practice. The national community of practice we've just secured funding for, and we will be piloting that in the coming months. As soon as I have information, I share it straight with Katie, and we'll get that all out to you. Another reason for joining the faculty emailing the mailing list, and that will be supporting at a national level people who are aspiring to be or are working towards or already working at or wanting to support the advanced practice workforce in mental health. So that's the work that's underway. The steering group's formed, the education forum is formed, and we're working on the national community of practice. So we are getting there. And then if we move on to the next slide, we'll talk through a little bit of local as well as national information. So we have 5 early adopter sites delivering programmes in the UK, and they have recruited their second cohorts, and we are working with them, including the learners on the programmes, to evaluate how the programme's going and what their experiences are. We also have an agreement, because we haven't been able to get early adopter sites for every region, and this includes the East of England. We've also been working to get agreement to deliver across all regions, and Katie has more information about our involvement with ARU and UEA to provide within the East of England region. Another piece of work we're doing with the Centre for Advancing Practice is to secure endorsement for our credential. We're one of the first of this wave of credentials off the block. I'm leading on taking this through the endorsement process. It's faring very well. I should find out next week how we've come on, so I better not chance it too much, but I'm hoping that we will secure endorsement. The importance of that is it shows that the curriculum and the capabilities are recognised as trustworthy content. And then, as Katie already mentioned, we'll also be looking at scoping the portfolio route. So there is work underway, there is work coming, and it's about us all working together to understand the pain points and what we can do to overcome those, but also for all that creative thinking about where we can take these roles and into which parts of the mental health system they would be best placed. So I think that it feels like a whistle-stop tour, but the next slide really is a little bit of an opportunities piece before we think about where the roles could go. So where we are at the moment, the opportunities for this framework, we're with the 5 early adopter sites, we've already got the content embedded within the MSc Advanced Practice courses. So the 5 courses, you go through some of the same content as other advanced practitioners, and then there's a development pathway for this framework. For those of you, like Katie mentioned, who don't necessarily need to do a full master's or already have one, it's about mapping yourself into this framework, and there may be individual, very specific learning needs that you can take through your appraisal system to identify what you want to work on next. If you feel you've already got most of it, but these are the things that you just need to do to elevate your knowledge and skills as you go forward and consider the portfolio route. And then we've got these opportunities. We've got this, it's not just one role. Advanced practice in mental health is a level of practice, as Katie mentioned at the top of this webinar. Where can we take these roles? Which part of the system really need advanced practitioners from a multiple backgrounds in terms of their own professional backgrounds, and how do we adapt the existing workforce and think about the responsibilities we can offer to retain the real talent that we have in the mental health workforce and offer some really good career development opportunities. So then we move on to the question, and the question I posed at the start of this. And if you have suggestions about thinking about your own work, thinking about where you'd like to see advanced practice in mental health move into, any emerging settings. We already have therapists, for example, in prison settings. Can we have our advanced practitioners moving into there with the specialism of mental health? And so if you could put some ideas in the chat so we start to get a feel of where we think these roles can play in practice, then that would be really helpful. And then my final slides are just a thank you. In terms of the advanced practice work, there's a few links. Castle's got this. Oh, Kim says general practice. Absolutely. I think that's going to be key in terms of how we move all of these roles into, and we're beginning to get more roles into general practice, and the primary care setting I think is going to be key, and the perinatal mental health midwifery advanced practice role, absolutely, as those services are beginning to expand. So there's some links there. The slides are with the East of England team, so they'll be shared around afterwards, so you'll have all of those links. And please do keep in touch as this work evolves. Thank you. Any questions? Oh, the chat's filling up with some great. We could basically just go anywhere, I think, is the answer to that one. Katie.
Yeah, I'd agree. Thank you very much, Stephanie. And I think, yeah, please keep putting your suggestions in. I think the reason we were asking is, I think from our point of view, we have a perceived idea of where we think these AP roles could sit and be developed, but actually you might have other ideas that we hadn't thought about and how we can kind of, so that's what we're kind of asking for your feedback on this. So that's really great. Thank you very much. In that case, have we got Stuart? Are you on? You are. Lovely. So I'll hand you over to Stuart, who's just going to explain his journey from an advanced practitioner, well, into an advanced practitioner, sorry, Stuart, and now into his consultant post. So I'll hand it over to Stuart.
All right, lovely, thank you. Apologies, I'll just get my slides sorted quickly. Hopefully those are being shared. Can everyone see those all right?
Yep, can see them.
Oh, fantastic. Okay, so hiya. So I'm Stuart Maddox. So I'm the Advanced Practice Lead for Norfolk and Suffolk Foundation Trust. So yeah, so those are really fantastic presentations, and really does a fantastic job of setting the scene in terms of what's happening nationally and regionally. So I think we're in a good position in terms of mental health. So if we go back to sort of 2017, 2018, mental health wasn't a priority area. So at this time, we didn't have a framework in terms of the national capabilities, and we certainly didn't have any support. Well, the support was less regionally in terms of mental health. So yeah, it's really good. It's really come a long way since this time, and yeah, I think it's good. It's really positive in terms of I think mental health does need these roles, and perhaps more than ever. So yeah. Okay, so as part of this presentation, I'm going to talk about the advanced practice role that I do, where things are in terms of NSFT with these advanced practice roles, the experiences that we've had, the challenges, and some of the solutions that we've found, and also how it's impacted on care pathways and models of care, and some tips and reflections for anyone else who's either starting out on their journey or come up against some similar challenges. Okay, so in terms of my role, so I'm a mental health nurse. My route into advanced practice, so I was a nurse prescriber for several years, and then I went on to complete the MSc for advanced practice. So I was working in a specialist service for adult ADHD, and then also working across the adult CMHT. particularly during COVID times. So I've had an interest in the advanced practice and getting this established. And as I say, when we first started out, there wasn't the framework, so there wasn't as much support. So it's very much a case of sort of thinking, how are we going to approach this? How can we get this established within the trust? And also many other people were having sort of similar problems across their trusts and in other areas of healthcare as well. So that's sort of where I suppose some aspects of the advanced practice lead role began, and it's developed from there. What I would say is, I think if other trusts are thinking, do they need an advanced practice lead? I think from my personal experience, I think it's really key. So we've heard about the national work, we've heard about the regional work, and it's of a really high standard in terms of thinking about how we can then bring that into the trust. I mean, the will's there. Everyone's willing for these roles. The senior leaders are willing, and yes, there were a few barriers to begin with, but everybody's very much starts to see the benefits of these roles as they begin to establish. But I think we found that I think there needs to be sort of a group of people working on it to really drive it forwards, because what happens is so many people are busy, aren't they, in healthcare, and there's so much stuff going on that it really needs somebody to sort of keep it on the sort of top of the agenda, keep sort of prioritising it, and to bring all the different parties together as well. So we'll go on to this a little bit later, but in terms of the sort of within the organisation, things like workforce, HR, training and education, the apprenticeships, all of these things, and all the things that we're hearing about at the national level and the regional level, and it's such a good piece of work now in terms of sort of defining what we need to do, the remit for it, and why we need to do it, and how to go about it. It's that implementation that we need to be focusing on from a trust perspective. So I think it's I do think these roles are key in terms of the ACP lead, and I suppose from our organisation, I think in terms of the mental health trust, we've been quite fortunate that we were perhaps slightly ahead of the curve with being able to get one of these roles. And I think, as with a lot of this work in advanced practice, it's more established within the acute trusts. And if you look around the acute trusts, it's sort of commonplace for these advanced practice lead roles. So I find that we're sort of following in their footsteps to some extent. So a little bit about what's happening at NSFT. So people may be aware, so NSFT were going through some hard times in terms of how the trust was sort of about 2017, 2018, and I think we're quite fortunate in that respect. So we're given some funding for these ACP roles, for the trainee roles at the time. So we've actually got quite a lot of advanced practitioners, and in various stages of trainees and having completed their training, qualified ACPs. So what we found is that, and looking at the evidence around this and the literature, it's very much a case of what other people have reported in terms of those barriers, in terms of the lack of clarity about the understanding of the roles, the barriers to establishing them. Perhaps there's not the will to take them on, perhaps through a lack of leadership, or some senior clinicians aren't supportive of the roles. So there are lots of things like this that we came up against to begin with. And however, the full credit to the practitioners, really, that they've sort of worked in their independent areas, so across forensic, patient crisis team, CMHTs, specialist services, homeless services, and they've developed these roles, and a lot of it's been about creating the vision for it, because I remember in the early stages of it, as a case of having these discussions about, well, what is advanced practice? How does it vary from a nurse prescriber, for example? What's it going to bring to the team? And it's very much a case of creating that vision and starting to evidence how it's going to have an impact for the service, and why managers would want to support it. So this is well underway now, and sort of reflecting back to where things have come from. It seems quite remarkable, really, because yeah, there was a lot of hurdles at one point, and it was a case of thinking, well, how are we going to establish these roles? A bit of fear, thinking, well, doing all this training, are these roles actually going to come into fruition afterwards? And then it's like a lot of things, isn't it? It's once that role's in place, it's like the specialist nurses or independent prescribers going across sort of allied healthcare professionals as well. But if you once there may be a little bit of, perhaps should we say, opposition in terms of getting that post established and having to create that shared understanding and vision of it. However, then it becomes indispensable, and if it was to be taken away, the service really struggles to be able to function. So some of our experiences and challenges. So I think we spoke about some of these already. So thinking about the pathway from education to practice in terms of how will people go from doing their training into establishing a role. And so I think this is going to be easier in terms of the new framework, in terms of that there's more guidance and more structure to it. So in terms of the appraisal, in terms of the supervision, the work-based placement. So I think all of this is going to help in terms of people being able to develop that sort of more mental health specialist learning, and being able to develop into roles as alongside that education. So I hope that will improve things. So in terms of, oh yes, so in mental health specific education and training, and I think that's going to be really beneficial in terms of having that framework and having those mental health specific capabilities, in terms of being able to provide guidance for people in terms of they've got a supervisor and saying, well, this is what I need to do, this is why I need to do it, and providing that sort of overview for it, and direction, shall I say. So availability of roles on completion of training. So I hope that now that we've started to get the advanced practice roles established, that it sort of gains some momentum in terms of the vision for these roles. People start to see them in place, and it actually becomes a case of saying, well, hold on, that team's got one of these roles, we want one of these. To the extent actually that some people are so keen to get these roles, it's now a case of saying, well, hold on, people do have to do this training, and particularly thinking about the register that was talked about earlier, in terms of we need to ensure the governance is there. So I think that's another important thing that trusts need to be thinking about when embedding this. So in terms of governance, so there's lots to do in terms of the governance. So job descriptions, policy, supervision for the future trainees, appraisals, portfolios, all of this. So it's lots and lots of work, and I mean we've been really fortunate. I think we're going to come on to this on the next slide actually. So about working with colleagues in the acute trusts, and where they're further ahead with the work, then being able to kindly share this with us, and actually include mental health in the across the ICS. So yeah, it's positive. So there is lots of work to be done, but again, I think if there's people driving it within the organisation and prioritising it, and there's also lots of support out there for it. So another thing that's key is in terms of workforce planning. So starting to realise that there's actually scope for quite a lot of ACP roles, and actually when we're thinking about the medical associate professions and the physician associates, when you start to think about it, there's actually, in terms of sort of being needs led and the scope for this work, there's actually more than enough to go round, we're noticing. So it's well worth doing the workforce plan and thinking about it, and also thinking about the sort of career trajectories for these people in terms of advanced practice. So what CPD are people going to need throughout their advanced practice career, and where will it be going from there in terms of going to consultant practice roles, and what CPD are people going to need to ensure that they're ready for these roles. Also, in terms of the trainees, what support are people going to need in terms of the trainee roles? And who will be providing that supervision? Is it going to be the advanced practitioners? What support will they need for that? So some of the solutions that we've found, found it's key to develop that shared understanding, particularly around establishing the new roles. So normally it seems, there's some research done for NMPs in the trust, and I think it applies to the ACPs as well. So where there is, where a team hasn't had an independent prescriber or an advanced practitioner before, it's whilst these roles have been around for a long time and there's lots of evidence and there's lots of policy around this, it was almost like that person's role, it was like it was new. So it's very much a case of establishing the shared understanding, making sure everyone was on board in terms of senior clinicians, senior leaders, senior managers, and your junior colleagues as well, to give that full support. So we found that the Trust ACP forum has been beneficial, particularly if people are having sort of struggles, or if they were coming up against barriers perhaps specific to their, or well, within their area of practice, and then it was quite often that they were shared across other areas of practice as well. So being able to share ideas around this and brainstorm. And so also we've set up an oversight group. So and I must say a lot of these ideas have actually come from colleagues in the acute trusts and other local trusts and other people who have been working on this. So I can't take full credit for this, but so setting up the oversight group has been absolutely key, and seeing this in the acute trusts and the benefit that it's had. So we found that that what was happening from the ACP forum is that there'd be a list of actions to happen, and then people go away, have these discussions in silo, but then when they come back, nothing had really been able to move on, because we needed all the right people around the table at the right time. To be able to take things forward. Otherwise, it'd be a case of having a talk with, having a discussion with HR, and they may say, yes, yeah, we're really supportive of this. We want to be included. We want to find out more. However, we need you to speak to this person, or have you done this? And it would just get sort of passed round. So we found that it was really key in terms of having those joined up discussions to be able to take things forward. So in terms of other solutions, so thinking about the ICS ACP group, so working across the ICS, so as there's Norfolk and Suffolk Trust covers 2 ICSs, so the Norfolk one and Suffolk and South East Essex. So this has been invaluable. So working with the acute trusts and having some focus to be able to keep it on the agenda in terms of saying, what are other trusts doing in terms of their development? Where are other people up to? And it's not nice to have the support as well in terms of thinking, well, it's normally 1, 2, 3, 4 people sort of really working away on this in terms of the governance and policy and bits and pieces like this, and being able to share experiences and ideas and support. So that's been really beneficial. And thinking about policy and framework, we've still got a way to go with this, but I think that's going to be vital in terms of really defining what advanced practice is, when an advanced practitioner is an advanced practitioner, of information about supervision, appraisals, training, what they can do within their roles. I think this is going to help massively, and something that we're working on as well, utilising some of the work from the acute trusts. Okay, so in terms of the impact of advanced practice roles, so we've seen a huge impact from these roles, and I've realised certainly nobody ever comes to us, and there's never any complaints about these roles in terms of nobody wants to get rid of them. That's for sure, and I think that's worth noting, especially in light of some of the barriers of establishing them. So in terms of the impact, so it improves access to treatment and care, increases decision making. So you've got highly skilled clinical leaders within the team, and that's a pillar of expertise for all the other clinicians and leaders as well within the teams for making these decisions. And it helps upskill other staff. It helps create a vision for developing within these teams. Okay, so also there's upskilling the team, and so decreasing waiting times. If people are able to make those autonomous decisions at the time, it just means that people are able to have that increased access to treatment. So the way there's increased throughput, it means that the efficiency is improved. So it also increases discharge rates, decreases bed occupancies, increases patient satisfaction, safety and quality of care, and there's a career pathway and retention of staff. Okay, so in terms of a summary, so advancing roles can still be considered new in some aspects, although they're not technically. They've been around for a long time, sort of going back to the 80s. There's evidence of these roles being discussed. Interestingly, with a lot of the same barriers that are still faced today. Although I hope that these are getting less. So I think it is worth considering this and what support that needs to be put in place for establishing them, because there are so many benefits. So having executive support and buy-in for these, input from senior leaders within the trust is key, and maintain advanced practice as a priority within the trust, and work collectively and collaboratively to embed national policy with the support of regional ICS meetings, trust oversight group and an advanced practice forum. So advancing roles will be pivotal to delivering care, functioning of teams, recruitment and retention of staff. There may be some barriers along the way, however, keep going. And so the tips are much the same really as the summary, but so thinking about planning the workforce, maximising the benefits of training and future posts. So you want people, it's going to be beneficial if there's people in training to think about where these posts are going to be post training. So if they're in a CAMS team, are they going to be developing a role in a CAMS service? Because that's going to work better than sort of then establishing a role in an adult service. So ensure collaborative approach with medics, managers, HR, workforce, create the vision for ACP and mental health. So the more buy-in you get, the better, and it's always best to involve people right from the start, isn't it? And develop an oversight group so there's all the right people around the table at the right time to improve the outcomes and decision making. Okay, so that's everything from me. I'll pass you back to Katie and the other presenters if there's any questions.
Thanks, Stuart. That was really helpful, and I think it's really key for people to see what it's like in practice on the ground. And I must admit, in my previous role, it wasn't until we really set up that advanced practice oversight group that the work really took on, and you had the right people in the right meetings, because where APs fall, you need your clinical supervisors, you need your medical teams, you need your HPs, you need your director backing to really enable these roles to reach their full potential, and to have that level of accountability that's required throughout an organisation. So from a HE point of view, we are producing a governance template document, which should hopefully be out, and pushing it back to October realistically. And nationally, we are looking at the governance framework and the tools that we can provide to help organisations really embed this as it should be. So thank you, Stuart. It's really helpful to see how as an organisation these roles have progressed. So this is the interesting bit now. This is where we throw it back out to everyone on the call. This now provides you with the opportunity to ask us any questions. So if you can pull it in the chat box, you can put your hand up, and I think Kashka will be able to unmute you. But yeah, this is the opportunity. We've got longer than expected as well. So if you do have any questions or concerns, pick our brains. If we don't have the answers, then we will certainly come back to you. That's not a problem at all.
We have a question for Stuart, actually, in the chat, saying, how are you managing the research element of your role, Stuart?
Oh, hiya. So that's a good question. So I think the research pillar is often the pillar that sort of drops off and doesn't have as much time allocated to it, unfortunately. I mean, there are research projects are underway. It's I think it's a case of being able to complete it, and yeah, I guess it is quite challenging, but I suppose one potential solution and something that we've been discussing about is actually having writing the 4 pillars into the job description and saying, well, how is time going to be allocated across these 4 pillars? So yeah, that's one possible solution, but it is a challenge sometimes to fit it all in. Yeah.
Yeah, I would say the same. As a psychiatrist, it's always how do you embed the research in it, and it all depends on your kind of passionate to engage in research. But if you kind of look for more of a protected time, there are a lot of NIHR grants and fellowships that you could apply as an advanced clinical practitioner or non-medic. Actually, NIHR are now trying to encourage non-medic to engage in research more than for medics. So I think it's a great opportunity, but even without specific funding, it's really important start of the job to go back to the job description and job plan with your supervisor and sit on it, and really important to make sure that you have enough time for it.
And can I just add from that, coming from, I used to work in higher education on the pre-registration masters courses, and you've got pre-reg masters students who need dissertation topics. So it's also facilitation of learning as well as research. And quite often busy clinicians have got banks of data or research questions that need answering. So it's not always about doing the research, or it's about engaging in research at a level that you have the capacity for. So making links with your local HEIs and thinking about supervising or contributing to dissertation research projects is also one way to suggest.
And I'd also say from my background, it's also about not necessarily looking at research as that huge research piece. It's also about service improvement. It's not audits on its own. It's about how you use that knowledge to change your service or improve it, and how you then reflect and actually audit that correctly. So things like the CUSA methods, there's different ways of being able to access or hit that research pillar. It doesn't necessarily have to be that huge research piece that I think everyone thinks about. It's ongoing evaluation of your role, the impact of your role, the service that they're providing, and how do you improve that? How do you keep up to date with publications and new research, and how do you then embed that and change your service in line with that? Being able to critically evaluate that research and is it robust, and being able to then form and change the service that you work in from that. There's different aspects of how you hit that research pillar. It is the hardest. We know it's the one that generally gets dropped or not picked up at all within practice, and that's why certainly when we're talking to the ICSs and the organisations, it is about ensuring that within the job description and the job plan, time is allocated for that, and to enable you to then be able to hit it going forward. There
is a question. So someone has done the general ACP course, which they completed in 2018, and they want to know if they would need to do a top up for the Pacific mental health part, as there was very little focus on mental health when they did this.
I can pick that up to start with. I think that my first suggestion, Helen, would be to map yourself into the mental health curriculum and capabilities framework, and then see how much the chances are, if you work within the setting, you will have already covered a number of the capabilities, and then it's a case of, like Stuart was talking about, it's this ongoing CPD for our own development. So you could use the capabilities framework to identify what you already know, think about how you could evidence that in preparation for a portfolio submission if you wanted to do that, and then identify your ongoing learning needs to run through your appraisal.
What I'll also say to kind of back that up, it is one thing we are looking at with the national team is how do we then support the credentials as they're endorsed by the centre. And yes, if you have an ACP course, we wouldn't expect you to go and do a whole new ACP course. And if there are credentials that we feel that actually could be linked and mapped against the MSc module, how do we as a regional faculty then fund that to enable you to do it if it is identified that that would be beneficial within your role? So I don't have the current answers for that. These are the discussions that we're currently having, and it will impact on our funding routes of how we then enable someone who has an ACP to do not necessarily a top up, but it would be then that credential piece of work as we're then looking at supporting that portfolio piece of work as well. So as soon as we have more clarification on that, we'll let you know. But I agree with Stephanie, you've probably got an awful lot of evidence already there. It's just actually using then those credentials to actually really map and hone down, can you evidence all of it, or is there anything that actually you feel is missing, and how, when you speak to your line managers, how do you then develop that and enable you to gain those capabilities?
Hi, I was just going to come in here. So for anyone who doesn't know, I'm the Supervision and Assessment Lead, working with Katie in the Faculty of Advancing Practice. And I'm working with currently 2 universities in the region, so we can create something a little bit more specialist focused mental health wise. Shimrit, Dr. Siv on the meeting call today is also working with me on that. One of those HEIs will be delivering a specialist mental health module moving forward. As regards the person who's already undertaken the ACP generic offering, you know, I'm happy to have a discussion with them about that, but it's very likely that your course anyway may be going through accreditation at some point over the next 12 months as well. So in terms of you getting onto the directory, if that's backdated to a point where you graduated on that course, then you would go onto the directory anyway, because you were actually on a cohort that was part of that accreditation point. It seems a bit complicated, but I put my email in the chat and you can contact me about that. But we're definitely doing some more work about trying to embed these credentials within courses, because we recognise that the ACP generic courses at the moment, they're very good, but for some professions they're finding there's not enough focus. So I'll be working with them to ensure that gets put in over the next 2 to 3 years.
I see there is a question about CAMS, and I definitely can answer that. It's Kim. So there are plenty of opportunities to work in child and adolescent psychiatry. So it's very similar to the adult psychiatry. You have to kind of look for what there is a need in the system, and also what you would like to do for, depending on your passion. For example, in an inpatient unit, like I said, in an adolescent unit, you could be the clinical lead of the team. So there is a massive shortage of consultants, and I was the lead consultant of general adolescent unit, Darwin unit, and we actually looked for someone to work alongside with me to hold the entire caseload, so that we could share some clinical responsibility. It's a fascinating job. You have full responsibility for staff, patients. You actually do second opinions for the entire east of England about whether to admit, not to admit. You work with NHS England. You have student nurses and student doctors, student occupational therapists all the time. So this is one opportunity, but there are other opportunities in crisis team, in home treatment. So crisis team and home treatment is not the same in CAMS. You have crisis team that works, for example, for 2 weeks for really crisis admission to the acute hospital, and they provide very emergency response. And home treatment is a specialist service or intensive support team that goes to the home and support the young people, and we need advanced clinical practitioner to manage these services. So these services are not medic led usually. In community, there are lots of opportunity for advanced clinical practitioners, all sorts of special interest, whether it's for example, ADHD service, ASD service, core pathway, which is the equivalent of locality team in adults, eating disorders. So yeah, a lot of services within CAMS. It all depends on your interest, and then if you have any difficulty persuading the services that it is needed, talk to me and I can help you.
The next one I think is from Brett, which is discussing the nursing diploma and can you go do the MSc. Now it will vary depending upon the HIs, and I will pull Amanda in for this as well, what their prerequisites are. The fact that you've done the prescribing qualification, if it was at level 7, what they're asking you to normally demonstrate is that you can work at that level, and that there is something in between you doing the diploma and that to show that you would be able to work at that MSc level. So it would depend upon the university. I think if you've done your prescribing at level 7, then you should be fine, because you can show them that you can work at that level to obtain the masters. Amanda, will there be anything else you want to add?
Yeah, I agree. Exactly what Katie's just said there. They'll look at any prior experience that you've had as well, and then they'll make a decision as to whether you can enter the course. But moving forward, they'll also be asking whether you've had a conversation with your line manager and whether there's going to be a role for you available at the end of the course. So I think it's worth having a conversation with your line manager and seeing if they'll support you with that, because that's going to be just as important now as whether you have the right sort of academic requirements.
Yeah. Kashka, were there any other questions that we've missed?
Sorry, I was trying to unmute myself. I saw a question very early on about how to sign up for your forums. I think it was Shimrit.
So yeah, we will send the invite after this webinar to everyone who's here and everybody's interested.
We can also put it on our mailing list. So if you sign up for the mailing list, we generally send out an email back out to you once a month with any updates, certainly any conferences, any webinars that are going on, or any general new publications that have come through. So we don't bombard you with lots of information. As I said, it will be the one way that we'll do that portfolio route as well, and that's something that might actually come out outside of that monthly, just because it will be a first come first serve. So that's probably going to be the easiest way. We do have a regional page on the Centre of Advancing Practice website as well. There's an East of England page, so any updates do go on there. It can take a little bit longer because of the comms teams and how they work with one another. And we are also active on Twitter, but that is the East of England Twitter account as well, HE Twitter account. So there are lots of different ways, but yeah, we'll certainly advertise the CPD sessions through that as well.
I can see another question here about practitioners. They're asking, is the portal opened for the route so they can get onto the directory, and do they know if their ACP programme is accredited? So currently at the moment, if your ACP programme has been accredited and you have passed that master's route, then you're able to actually, you're the only people at the moment who can go on the portal and actually put your certificate on there to prove that you've actually undertaken a course that's been accredited. So for anybody else, that's still not open at the moment. Thank you, Christine. You put on there how you can get onto that directory. But just to say again, that's only for people who've actually undertaken an accredited course, and those people would know they've undertaken that accredited course because they will be sent an email by the HEI directly to let them know that's happened. So if you haven't received that, that means that the course isn't accredited. Currently in the Eastern region, we don't have any HEIs that are accredited. So for anyone that's on the call and they're concerned as to whether they are or are not on an accredited course, we don't have any universities in the region that have got that accreditation. That's not because there's a problem with the course, it's just because it takes time. And we've got some who are booked in over the next 12 months to go through that accreditation route.
Thanks, Amanda. Are there any other questions? Or you might get some of your time back. You might actually be able to get a lunch. What I would say is, obviously, we will send out the links to the presentations. They will go on the website as well. If you do have any questions, please contact the faculty. We will be setting up open mornings. We have the generic email. We will get back to you as soon as possible. When we've done within the mental health for advanced practitioners, it would be really beneficial to know what you found useful. What do you think you're still lacking information wise? What more support do you need? What would you like us to concentrate on going forward? So any feedback would be appreciated and very welcomed, positive and negative. This is a learning curve, and these are about supporting you as practitioners and organisations as best as we can going forward. So please, yeah, all comments very, very welcome. So I'll give any questions. Or does anyone else want to summarise or feedback before we give you your time back? No, in that case, thank you everyone. Oh, there's a new message.
Sorry, that's me.
Thank you, Kashka, you're on the ball. Firstly, yeah, thank you everyone for attending. Thanks for all the presenters today for giving us your knowledge and insight on this. And this is the first of many. We'll continue with these going forward. So thanks very much everyone, and have a lovely afternoon. Bye.
Thanks, Katie. Cheers.